Hi there, welcome to Speechy Digest, your one-stop shop for speech and language therapy videos. In this video, we'll be telling the story of how speech and language therapy came to be, what we do, and where you might find us if you're looking. Before we begin, please press the subscription button down below and click on the bell icon to be notified of Speechy Digest content. It's free! History and background. So how old is speech and language therapy anyway? Well, while the profession is relatively young when compared to medicine and dentistry, there's evidence of speech therapy practices from as early as the 18th century. A 2018 study conducted by Dr. Elizabeth Foyster of Cambridge University discovered just that. Dr. Foyster unearthed an advert published in the Postman newspaper on the 23rd of October 1703 by a man named James Ford. James Ford claimed that he removed stammering and other impediments in speech. Dr. Foyster found that many other speech therapists emerged over the course of the 18th century, as speaking well was crucial to being accepted in polite society and to succeeding in a profession. Prior to this, in the 17th century, cures to speech impediments involved painful procedures such as cutting off tongues. Unsurprisingly, the less invasive approach adopted by speech therapists was much more attractive to wealthy clients. Since then, speech and language therapy has become a recognised profession practiced all over the world. In the UK, a professional body called the Royal College of Speech and Language Therapists, or RCSLT, was set up to unite all members of the profession. In 1948, King George VI, who received speech and language therapy for his stammer, became the college's first royal patron. Our role. So you know how we got here, but what do we do? Well, the short answer is, if someone's suffering from a problem that affects anything from the neck up, we're most likely going to work with them. Although the name suggests we only work with speech and language needs, we actually deal with a whole host of communication difficulties. This can include, but is not limited to, voice work, for example if you've got vocal nodules, disfluency, for example stammering or cluttering, and social communication needs due to conditions like autism spectrum disorder or traumatic brain injury. A lesser known fact is that some therapists are also trained to work with people with eating and drinking difficulties, a condition known as dysphagia. In short, speech and language therapists work to prevent, assess, diagnose and treat speech, language, social communication, cognitive communication and swallowing disorders in children and adults. Gosh, try to fit that on a business card. Client groups. As you might have guessed, speech and language therapists work with a wide range of people from newborn babies to adults in the very last stages of life. In babies, we're most likely to be working with those with feeding and swallowing difficulties. In children, those with conditions most often diagnosed at childhood, for example, autism spectrum disorder, cleft palate, and language delays and disorders. Finally, in adults, we come across all the conditions that persist after childhood, as well as those acquired following neurological impairments and degenerative conditions, including Parkinson's disease, dementia, and head and neck cancer. Settings. The places you might find a speech and language therapist are just as varied as the client groups we treat. We can work in schools, hospitals and clinics, care homes, and even juvenile detention centres. We go wherever our patients go. In the UK, if you need access to speech and language therapy services, you can contact your GP, district nurse, health visitor, and your child's nursery staff or teacher for a referral. You can also refer yourself by calling your local NHS service and asking for speech and language therapy. Misconceptions or alternative facts. Now before you leave, let's clear up some common misconceptions about speech and language therapy. 1. We are not speech writers. Although the name can be confusing, Speech therapists are thankfully not involved in preparing statements for politicians. 2. We are not elocution or accent coaches. Although speech and language therapy courses do teach how sounds are articulated and can be modified, our services are not usually used to change accents. 3. It's not just a short course. In the UK, speech and language therapists have to complete a 3 or 4 year undergraduate degree at an accredited university in order to lawfully practice the profession. Communication and swallowing is complex, and supporting those with difficulties requires knowledge of a broad range of subjects, including but not limited to linguistics, psychology, and biology. Hopefully now you know what speech and language therapy is and definitely isn't. Please remember to like, share, and leave a comment down below. Thank you for watching, and hopefully I'll see you at the next Speechy Digest.